we can't go back to those lockdowns.
No more lockdowns.
Those words coming from the leaders of two major political parties here in Manitoba, promising not to implement lockdowns no matter what happens with COVID and flu season this fall.
PC leader Heather Stephenson saying at a leaders' debate Wednesday that things will be normal heading into the fall months.
The unintended consequences of locking people in their homes and shutting down businesses is devastating, and we've learned from that. We've got tools in place right now to deal with the rest of that, where we can protect the most vulnerable.
NDP leader Rob Canoe echoing similar promises.
The idea of bringing our economy to a halt again is not something we can contemplate in the future of Manitoba.
Manitoba Liberal leader Dougal Lamont calling the promises irresponsible, something microbiologist Dr. Eliza Gerstein agrees with.
It's very, very concerning. We're in the midst of an election. We are also in the beginning of another wave of COVID-19 with a variant that, by all testing, seems to be the most infectious one we've seen yet, and the one that doesn't sort of care about our past infections. And we're at a place where most Manitobans have not had a vaccine in the last 12 months.
Manitoba's Chief Public Health Officer, Dr. Brent Rusin, recommending Manitobans 6 months and older, especially those with underlying health conditions, get the influenza and COVID vaccine this fall. Virologist Dr. Jason Kindrachuk says the COVID virus is still moving around.
If you're sick, stay home. If you have to go out, use a mask. We now know that we have these different types of, again, mitigation measures to try and reduce transmission. So I think trying to shift the messages towards those practical aspects is really, really important.
Manitoba had the highest COVID-19 fatality rate in Canada throughout the second and third waves. Dr. Anand Kumar says he doesn't believe we will see anything near what we saw in the past and doesn't think it's necessary to have lockdowns.
I think the hospitals can certainly sustain something comparable to what we've had in the past a couple of years ago. It would be difficult again, but we're certainly better prepared than we were before. But again, I would really emphasize the probability of any substantial wave, even approaching those kind of numbers and that kind of hit that we took, is really exceedingly unlikely.
In Winnipeg, Alex Karpa, City News.